depression, feeling lost, suicide attempts, and ultimately when someone decides to take their life. We see a lot of that in the correctional environment, across the state, across the nation, where people, 9 out of 10 of them come to jails that are addicted or co-addicted. That 6 out of 10 have either an undiagnosed or diagnosed mental illness. And half of them struggle with reading the menu. And yet we ask these individuals who many times have made bad decisions or just been dealt a bad deck of cards to leave and never come back. And that's why we're here today, because of a collaboration, because of teamwork, not just because of the individuals, but because of the organizations that we represent. Number one, I want to recognize Michigan State University Department of Public Health, Genesee Health Systems. With me is Dan Russell, the CEO of JHS, and who's been here for decades pouring into this community and has taken what we have here and has been a beacon of light throughout the nation, as well as my own office, the sheriff's office. Being the sheriff and representing the people is important to me. I start my 34th year this June, and I've been involved in law enforcement. I'm a licensed paramedic, and we've picked and drawn conclusions of what causes recidivism, what causes pain, and I can tell you that we in my entire career have never had the data that we have today because of the collaboration of these organizations, in addition to the people on my right who are the voices and the testimonies of those organizations and where we go today. So I'm excited because the data is going to show us some incredible progress, and you're going to see how this started over a decade ago. That's called tenacity. We are a group that shares with intervention, partnerships on mental illness, and teamwork. And I say that because I met this team to my right, as I said, over a decade ago when Dr. Jennifer Johnson called out of the blue and talked to an undersheriff and said that she's coming from the east side of the country here in Flint and was going to request access to jail records to study the depression and suicide rates of post-incarceration individuals. We became friends long ago. She is also a professor at the public health for Michigan State University and founding chair of the MSU College of Human Medicine Department of Public Health. Next to her, Marie Jones-Watts was the director of adult services of Genesee Health System, where she worked for nearly 30 years. And now she works right here in downtown Flint for the Crim Fitness Foundation. And I think it's important for those that are Crim runners. Crim has just done so much more than just the run. And the fact that you poured into mental health and so many people have taken advantage of it around the world. So congratulations. But I think the biggest champion we have is somebody who's actually participated in the intervention. I mean, we all go to school, we all study, but when you actually see the testimony, it makes it all worthwhile. So Karena Mitchell, I met you, and I'm so proud that you have the courage to be here and tell your story. We're going to get to that. So thank you for doing that. Thank you for the panel. Thank you to the media for sharing this story. And I know it's important that you never know what nugget's going to just settle into somebody that needed to hear exactly what was said today. So thank you for sharing the story, and thank you for your platform. We're going to get right into it because we're going to stick with a hard stop at 2:30. I want to introduce Dr. Jennifer Johnson. And the reason I bring her up first is not only because it's on the agenda, but she really spearheaded it and was really the driving force to get through a lot of barriers to get to where we are right now. So this county and this state and this country owes a debt of gratitude for what we're about to hear because of my dear friend, Dr. Jennifer Johnson. Thank you.
Thank you so much. And we're just so thrilled that this partnership with the Sheriff's Office and with Genesee Health System has persisted and been so successful. So, the biggest problem in suicide prevention is finding people at risk for suicide at the moment they're at risk. And our work has found something that we haven't known before, which is that 1 out of every 5 adults who dies by suicide in the U.S. has spent at least 1 night in jail in the last year. And hence, the importance of this partnership, because those folks are especially likely to not be well connected to healthcare. And, you probably know, but pretrial jail detention is quite different from prison. People aren't necessarily sentenced, they're not sentenced in pretrial jail detention. They may not be sentenced. They're often gone within a few days, and this is 8 or 9 million admissions a year in the U.S. And this is we found a time when a lot of times people have attempted suicide even before they were arrested. Even in the days before they were arrested, folks were in crisis, and it was important to find a way to reach this group to prevent that 1 in 5 suicides that are not currently being well prevented.
I think it's important to note that 80 million people in America have done at least one day incarcerated. Those are stats from the nation outside and from social justice advocates. And when you think about that, just 1 day minimum where your freedom is taken away and life really hits you hard of bad decisions. And when you look at the stunning stat, that's why I said everybody in this room and watching is something that they can recall back where they were impacted personally. And as we progressed in this study, the reason it was so difficult is because we'd never been asked. And usually there's a built-in adversary relationship between law enforcement and clinical studies. It's just being honest. You know, as a medic, we love studies, but as law enforcement, not so much. So to the fact that the staff at the sheriff's office has been so welcoming to not only my predecessor's vision on this, but also my vision to keep providing data, because I know those data points are humans, they're stories. And so it was important. When Dr. Johnson came here 10 years ago, I had no idea that it would take this long, but that's how this data you're about to hear is so important because of the long, slow grind of getting these points. They're not just, stats. These are blood, sweat, and tears, and we're talking data points and interviews and people trusting the process. Well, I can tell you, Dr. Johnson, you're the one that pushed it, and I can't do it alone. The partnership that I have with GHS, we have never had that in the sheriff's office like we've had over these last 7 years. And it's because of the community involvement. We saw it during 2020 when mental health was the topic. And so before I ask Dr. Johnson the second question, I think it's important to note that when we partnered, we said we had to do it with Genesee Health System. We had to do it with Dan Russell. And so I'd like you to hear from him and the reason why he works so close with the jail and why it's important to have this study to prove that what we're doing makes sense. Dan Russell.
Thank you, and thank you for the opportunity to be here. So, as mental health organizations, we frequently get requests to be part of research studies, or can we use, a lot of it has to do with, can we use your consumers or your patients, because all research needs subjects. Most mental health organizations are usually underfunded, understaffed, overworked, and having somebody ask one more thing is like, ugh. So a lot of particularly smaller organizations just kind of pass on research because it's really not our thing unless the organization is attached to an academic setting, and that's kind of unusual. At GHS, we try a different approach in that we value research. We do a lot of work with the schools, with the communities. So when the call came, it's like working with the jail. It's like, oh, not because that's bad, it's just that adds, as the sheriff said, not one of their favorite things either. We knew there'd be a lot of logistics and there'd be a lot of details and a lot of hurdles. But at the same time, we thought this is important because this is an important group that is underserved. And we knew from the very beginning that we were going to see positive results just because we know that treatment works. Now, I think we were a little bit surprised at how positive the results were, but we knew this was going to be important, and it's something that we really wanted to be part of and collaborate. So I would just kind of as a leaving message is that organizations should try, when they get the opportunity, to collaborate on topics like this because it is important for the field and it is very important for the people served. So thank you.
I think foreshadow what the results are. We're not going to share them because that's going to be your story, but you're going to be impressed and you're going to be thankful that what we started out to do, it actually was done. I know there's a lot of frustration sometimes about people that start a project and don't finish it. But Dr. Johnson, when you came here, what did you originally set out to do? And do you feel like you matched that outcome?
So, like I said, there had never been any studies at all of suicide prevention during this period, and when 20% of people are going to die by suicide. No studies, no effective interventions. And we set out to test and to find the first effective intervention for this time period. And to give you some sense, of our folks who we recruited people in the jail at risk for suicide and partnered with Genesee Health System to provide, we tested something called the safety planning intervention, which has been found effective in emergency departments and in VAs for veterans. And worked with GHS clinicians who came into the jail and then followed up with people outside. We followed them for a year. But people in our sample, their average age of first suicide attempt was 13. And so, again, sometimes people think, oh, well, they're just suicidal because they're in jail. But really, what I think happens is that jail pulls out people out of the population who are at risk and who are struggling with a lot of things. And that's why this is so important.
And I think it's important, too, that it's a vicious cycle, whether it's homelessness, mental illness, addictions, crime. What comes first? And many times, one of those variables drives to the other one. But when you set out to prove that there could be intervention that was not done, you couldn't do it alone. And that's why you partner with somebody who sits to your right from the Crim Foundation. So explain to us the partnership and the importance of Ms. Watts.
So back in the day, she didn't work for the Crim. She worked for Genesee Health System. And she was one of our counselors on this project for GHS that went into the jail and followed up with people afterward.
And Ms. Watts, I know the time is coming where you're going to be asked from Dr. Johnson, but I want you to know that there's a lot of trust that folks need to build when they leave the jail. And I have an interest on building that trust because of Ignite. In the jail, we broke the bonds of incarceration through education 5.5 years ago. And we knew that when inmates leave at 12:01, that if we don't have a wraparound program, then the likelihood of return is what people call recidivism, and nobody wins. But through education and through the wraparound services, we're able to give them a pathway to success, a pathway to homes, a pathway to medication, and that's where you came in. So your involvement is critical. What did you find when you're interviewing folks? How long did it take for you to gain their trust, and what did it mean to you personally?
Once I started working with the individuals in the jail, it didn't take long to earn their trust because they saw someone that they normally don't see in jail, a clinician, a counselor. And then, of course, we had to establish rapport. We only had that one opportunity. However, what I noticed is it was established fairly quickly because we were asking questions that probably they were not ever asked. We were asking about risk levels. We were asking about their history. And then we share with them the reason why we were coming to them and asking them and what would be the follow-up after jail. And so it didn't take very long to establish that rapport and trust, especially after they left the jail and we were doing follow-up calls for a whole year. As a matter of fact, I'm sure they were pleasantly surprised that we called just to see how they were doing and then offer them some resources as well as, some brief solution-focused type counseling during the intervention process.
So logistically, they would come into the jail and they would know who's being released and you would have those conversations. Tell us about the conversation involves a safety plan.
Yes, the safety plan actually is just a one-page document, so it's really simple to implement. And some of those conversations, like I mentioned before, started out with assessing their history, like if they've had a prior suicide attempt, if they had any family members that attempted suicide or completed suicide, which significantly increases their risk. We also talked about not only that, but also what support systems they have in place right now and what they can do in order to lessen the symptoms. And then that was one of the things we also talked about, the symptoms. What are some things that are going on in your mind, or what are you thinking about prior to you leading up to the decision, okay, I want to take my life? So we documented those things on this one-page simple document. And then we also talked about resources that they could follow up on following leaving jail. And also, they were in jail And so we also shared with them some options so that they had that safety plan. Because typically if you are experiencing symptoms, you're not going to remember what you wrote on paper. So we gave them some options like taking the safety plan, because they were able to take it with them, the paper, and putting it up on the refrigerator. Taking a picture of it when you get your phone so that you have it right there at your fingertips. And interestingly enough, that definitely helped.
And how do we give the media and our participants a copy of that safety plan so they can see that one page? Doc?
Yeah, we can get it. We can get it to you. We have several handouts over there. I didn't think to bring that one, but we could also share it with you. But it's, like I said, it's a conversation. You're not supposed to just hand out the piece of paper, but it's a conversation with the clinician. And the idea is when you're in crisis, you're not thinking straight. And so you need to write things down so you can refer to them and have them for the future. So, the first is, what are your triggers? The second is, what are things you can do to distract yourself? Because the idea is to keep yourself alive in that moment. The third is, who are some people you can talk to distract yourself, not about suicide. The fourth is, who are some people you could talk to about suicide? What are some professional resources? How can you make your environment safe? And what are some of the reasons to live? So it's a step-by-step plan, and you go to the next step if you're struggling with the one you want. And the entire purpose is to stay alive so that you can solve whatever problems that you're having.
And how important is it to point out that a moment of crisis and access to a weapon is the ultimate risk factor? Could you respond to that?
Yeah, absolutely. So we found that half of all suicide attempts, the person decided to do something in the 5 minutes before, and 70% in the hour before. And so having what we call lethal means, or something that is lethal, so a firearm, a knife, drugs, whatever, it is a risk, and especially unsecured firearms, because you can make more than half of suicides in the U.S. are by firearms because it's lethal, and you make a decision and it's final. And so, one of the things we talk about with people is making their environment safe so that they don't come home and make a split moment permanent decision.
So I think it's important to say that there's moments of calm that can quickly turn into moments of crisis. So in the moment of calm, that's when you do your preparation. You allow people to come in your life to maybe separate you from weapons and other things, just so you know it's coming, because crisis is not the time to do that. Is that fair?
Absolutely. And I would say that a lot of the risk factors for people going through the system are a lot of risk factors for those of you who are serving, which is exposure to trauma, exposure to stress, access of firearms and other lethal means. Those things are risk factors.
You're dealing with a very hardened population. Many times people in jails, they've just been struggling. What are some of the challenges, and what are some of the rewards? And how did you build trust with an inmate population that maybe they think, well, the sheriff sent you to get my information? There had to have been a breakthrough that showed that you're a different voice and a different heart.
Well, as I think about that, I can attribute that to my training and my own purpose in serving individuals who are struggling with mental health disorders. And I had been in the field for many years at the time that we were doing the intervention. So I would say also too, like I mentioned before, someone coming in to actually have a conversation with them, because it does start out with a conversation as opposed to let's just get this paperwork done. And establishing a rapport pretty quickly. So I would attribute that to just people can sense where you're genuine naturally. And in my work and experience in working with individuals who are justice involved, they know immediately just from their own personal experience. So being able to do that was the reward in being able to establish that rapport, as well as the reward of actually after the follow-up, after they had been released, calling and realizing when we shared like how things been, I use my suicide risk plan. Oh my gosh, that's great. Also too, the information that we put on the plan related to who can you call, because we do assess who can you call, what family members that you can rely upon, what resources in the community can you access, a majority of them took the advantage of that because they had that written document, and they also had that step-by-step process. If step 1 didn't work, then I moved to step 2. Step 2 didn't work, I moved to step 3. So that the reward in actually seeing that the intervention was working in that regard during our follow-up, at least during the time that we were following up, is definitely rewarding. And the fact that, there have been a few that come to mind that have actually shared that they had suicidal thoughts or were thinking about suicide, and the intervention was the plan itself, their plan that they developed, was something that took them in a different direction and saved their life.
In a few minutes, you're actually going to hear from a participant. But Doc, would you talk about triggers, stressors? What are some of the warning signs that you found when you did this research that are some of the common ones, no matter who the individual was?
Well, the reason we ask people individually is because it's a little bit individual, and it's knowing what's a stressor for you. But, I just want to emphasize, it's interesting. Those of us, I partnered with national suicide prevention experts. They universally said that our folks were going through more than any of their other people they'd worked with in emergency departments or the VA or anything. And I think, like I said, the jail, you disproportionately pick up people who have lost their housing, potentially been evicted, lost a partner, lost a child, had traumatic death around them. They're just, people are going through a lot, and a lot of times they have been for a really long time. And I think one of the things I want to tell Karena, not to jump that gun, but that all of us doing this work, we're just so humbled, honestly, to be able to work with you guys and to try to do something given the just absolutely staggering list of difficult circumstances as a whole that you were facing. We were really, and I'll speak for all of us, my national team across the country, we were really humbled because like I said, as a whole, you guys were just dealing with so much. Yeah.
Tell us about Karena Mitchell.
All right, so I will introduce you. She was one of our participants here in Genesee County in the safety planning intervention many years ago. We're really grateful that she's come here to be willing to talk about her story and the safety planning intervention and her experience. And just thank you for sharing your story.
Thank you for having me, but I agree completely with what the professionals have said, but since I'm here to give my own personal input on it, suicide is just not an instant thought most times. It's something that comes and goes. We all don't just jump and do because it's there, but we will be self-destructive and keep on that plan because no one wants, we're cowards. It's just what it is. You know you're not supposed to do it, but you're thinking about doing it. So, I understand that you guys have stopped the 50% and everything and all that. That's great. But for a person like myself, my suicide ideations were not do it now. It was, how could I get away with it without anyone knowing that I've accomplished this goal? So, with that being said, I was on a self-destructive path. I had traumatically lost a child, and I didn't actually just reach out for help, but I had small cries, but it was kind of hidden behind the fact that, well, this is the grief process. And that wasn't necessarily the case for me. It was, I already had a mental things going, and then this instant traumatic experience, and then you're in the spotlight. You don't have time to assess things or anything. It's it's presented itself, move, go, keep going, and then when everything settles and all the fuzzy and all the noise and everything is gone, you're left with a mirror check. And sometimes that mirror check isn't what you ultimately thought it would be until you actually sat and looked into yourself. So that time that I spent in jail, and then you guys came up and asked, it was really genuine. It wasn't like I'm some criminal or I'm less of a person. because I'm in this situation at this point in my life, you guys really talk to me like I'm human. You know, we all make mistakes and things of that nature, and you guys generally cared about what would happen to me after. And to say far as the year, I got calls all the way up until 6 years after that point, after I agreed. And within that time, I had lost another child. I had a stillborn child about 6 years, 7 years roughly after I lost that first child traumatic. And when I say these people stepped up, these people stepped up. So all I'm saying is don't look at it as a taboo. Maybe because the first try, maybe these first 3, 4, 5, it could be 20 people who don't believe you and brush you off. But keep instilled within yourself. If you're willing to work and control it, don't roll with it. Control it. Because you'll always be in a situation where you can roll with it. But as long as you imprint in your brain, I'm going to control this, and I'm going to move with it, you can't go wrong with a great team. And you guys have been there for me for so long. And I so appreciate you guys.
Thank you, Karena. When a couple rapid fire questions with a short answer. When was the first time you had suicidal ideologies?
That was around about, I would say 2010.
And how old were you then?
I was about maybe 30-ish or so, somewhere around there.
And was it the death of your child that started it?
No, that was just, I didn't know I was suffering with postpartum depression because I had 3 children so close together and so young. And I just took it as, they just gave me an antidepressant and kept it moving. It was something that was there, but it was never treated.
Got it.
And then it was just circumstances, being a young mom and things that went on, and I reached a breaking point.
And you mentioned the term small cries. What were some of the small cries that you were showing and hoping somebody would pick up on?
Like, for instance, a person usually reaches out to you on a regular basis. Normally they'll text you or call you or just anything. They're annoying. Then all of a sudden they just drop off, or you call them and it's no contact, but then they'll maybe not answer the phone, but they'll text back. Now, those are like, those are red flags. Those are kind of like cues to say, hey, maybe I should just go by and see what's going on, because normally this and this, you know. All the time is not always that time, because most times, yeah, we all want to be to ourselves, but with someone who's such as myself, if I break routine, then that should be a red flag for someone who's close to me. They know really what's going on.
And do you still have access to your written plan?
Yes, I do.
And where is it in your life?
Oh, it's inside my Bible, baby. That's next to God, baby.
It's a great answer. How many people have you been able to help because of your success?
For sure, I know maybe 2. Yeah. But I have talked to, countless others, because I was at one point in a homeless situation and was around other people, and you talk. Yeah. You're in that situation. You're with people that are in that situation. A lot of times I found out I wasn't on my own with my mental conditions and everything, but I also seen that there were a lot of us that were out there that weren't willing to be treated and were afraid to be locked up, whether it's psych floor, jail, or whatever, if they chose to decide to treat them.
Well, we are, believe it or not, already halfway through our agenda. It's sticking on our timeline, and we have yet to crescendo with the results. So before we get to that, what have you found when it comes to these types of preventions, when it comes to gender, race, religion? Are there some more than others? Is there higher risk factors? What did your research show for that when it comes to the population?
Yeah, so in general, not in the study, but in general, women are more likely to attempt suicide and men are more likely to die by suicide. I think it's maybe even 3 to 1 men, and it's on average they use more lethal means like firearms, for example. In general, historically, white people have been more likely to die by suicide, but there's a big uptick for Black Americans, which is really concerning, especially youth. I know a lot of folks are worried about some of the youth in Flint. But in terms of who the intervention works for, it has seemed to work for everyone. As a matter of fact, some of our national partners who came to us didn't think, because the folks at the jail on average are so likely to have substance use disorders and so many different things going on. They weren't sure that the intervention would work, but drum roll, it did. So yeah.
The results. These are data points that cannot be argued because they didn't get there without intervention, interviews, tracking. So let the people know what you found after all these years.
Yeah, and thank you. So we interviewed people for a year after they were released from jail. So we had 800 participants who were randomized to either get resources and sort of an enhanced care as usual, or half of them got that, half of them got the safety planning intervention. And we found that the safety planning intervention reduced suicide attempts by 55% in that year after release from pretrial jail detention. And again, that's a period of time that 1 in 5 of all adult U.S. suicides occur. So we reduced suicide attempts by 55%, making this the first effective intervention during this very high-risk time period.
I mean, honestly, that is a hand clap moment. Those are people's lives. Those are families whose family trees have been saved. But then I think of the other 45%. Those are the ones we need to reach. Much like Ignite, if it can work in a jail setting through education, it can work anywhere. Just like what you did, if it can work in a jail setting, it can work anywhere. Are your results published?
Yes, we published them in one of the leading journals. It's called JAMA Network Open. They're publicly available, and you can ask us about them. But yes, they're published in one of the best medical journals. So a lot of people looked at them. What
does it take to get data like this published? It's not just you're writing an op-ed and they publish it.
That one, I don't know. You have to distill everything down into 3,000 words, and we had so many people look this over and went around so many times, I can't even tell you.
And you're going to peer study groups. They're ripping apart your data. They're making sure that it's validated. They're checking. And when Dr. Johnson said that it is published, that means others can use it in their template. And if it can work here, how do we do it in other facilities across the state, across the country? What's the plan?
Yeah, so we're definitely scaling it up. It's definitely now best practice. To give you some sense, I keep using this 1 in 5 statistic, but that's how many people die by suicide after a visit to the emergency department for suicide. And we've done all this work around those folks, which we should. But really, this is the first time we've addressed, this riskier population. So we have applied for and received money from the National Institutes of Health to create something called the National Center for Health and Justice Integration for Suicide Prevention, or NCHATS. And through that, we are working to use publicly available booking and release data to connect folks across the state and across the country to healthcare systems who can reach out and say, hey, how's it going? They don't say, hey, I heard you're in jail, but they say, how are you, Mr. Smith? Haven't heard from you in a while. How's life going? Anything you need? Anything we can do for you? And to try to connect folks back to care in the community that way, because what we're bringing to the attention of people, I think, across the country is that this interaction with criminal systems or legal systems is a risk factor for suicide.
So we heard Karena's story, and this is a question for both the clinicians. What story in the last 10 years of the 800 stood out to you personally that struck your compassion chord, that has just burned inside of you as to this is why we do what I do? Who is this person? What is the moment?
All right, can I ask a different question?
100%.
I want to hear, so you talked about your story. I want to hear, because you're in a better place now, right? Yeah. I want to hear how you came from this really difficult set of circumstances in your life to the place you are now. Like, how did you do that?
I really just stuck with, my suicide plan, that was really like number one on top when I got released. Because I still had to go out, I still had to wait for upcoming appointments and things of that nature. But when I got started, I really was at the point like, I'm gonna do this. And it took me about maybe 4 years before my medication was even together for me to feel like I can go to the grocery store. But it's the fact of stick with it. Like I say, my motto is, I'm gonna control it. I'm not gonna roll. I'm gonna control it. So If you can get into a place where you say, I'm more than what my mental disease or disorder is, then you can make it. You only lose if you let it win. Long as I don't care how many attempts you've had, long as you wake up and you're here and you're still willing to stand there and I'm trying, then you have a great chance to succeed. As long as you just don't give up. You have to keep saying, I'm worth it. And that's what matters. You're worth it.
Ms. Watts.
So, yeah, you gave me a minute or so to think about it. I can't think of one person. I think it was just a collection of the fact that, number one, we showed up at a most vulnerable time while they were incarcerated. Number two, we showed up and we actually cared and had conversations about something that is taboo to talk about. Like, oh yeah, I've had this incident of thinking of suicide, or I had family history of suicide attempts. And the fact that we show that we care and that we actually open the door to have the conversation is that thing that sticks out to me. And that also follows into the follow-up phone calls that we had after the fact. Because let's face it, some of the interventions or things that might happen in jail may not travel afterwards, may not connect afterwards. Also, the connections that we made with community resources was very important, and people did connect. So I think the fact that they followed up and they actually used the safety plan, followed the safety plan, even recognizing triggers that they probably didn't even have an opportunity to talk about, is what sticks out. The fact that this, like, I knew this worked just based on having the conversation and implementing it in jail before the results were published, because I was seeing that through the follow-up phone calls.
We love the research. I mean, obviously, the 55% reduction, but that's a research team. The CEO of GHS has been intimately involved on championing true treatment throughout the whole county. So, Dan, would you tell the people, not only in this county, but what we're doing on a practical level for people that may not be incarcerated but are going through a crisis? What resources that are out there? What facilities are there that most people or maybe not even know that we have this in Genesee County and beyond?
Sure, thank you. And I do want to say, as far as being asked the research question lots of people get, Dr. Johnson made this pretty easy. There were a lot of, like I say, working with the jail, just getting into a jail if you're not supposed to be there and you don't work there is pretty difficult to do. The sheriff's department made that as easy as possible, and Dr. Johnson made the requirements for the staff pretty easy. So it wasn't too difficult to twist people's arms and say, hey, how'd you like to do this research project? So I think that is a credit to both the sheriff and Dr. Johnson. So just one thing that we're doing in Genesee County that kind of ties into this is there is a fairly epidemic level of lack of good hospital beds across the country, across Genesee County, across Michigan, for individuals in mental health crisis. We at Genesee Health System have done a couple things. We have a 24-hour behavioral health urgent care, and along with that, we also have a crisis stabilization unit. So before this, and we are just opening now as a matter of fact, if you have a crisis at 3 a.m. before these services existed, you usually ended up to one of two places. One was in the hospital emergency department or in jail. Neither one which is appropriate for many reasons. The most basic being that's not what those places were designed for, and the individuals are not getting the care that they deserve. So we have done that with our crisis stabilization unit. Individuals will be able to go there and de-escalate without having to go to jail, without being picked up, or without having to go to the emergency department, sitting on a gurney in a hallway for 12 hours because they don't have a social worker that can get to you. So those are some of the things we're doing in Genesee County, again, with collaboration with lots of the organizations. We have a great relationship with the Sheriff's Department. We have co-response teams so that when a call comes into 911 and the trained dispatcher says, this sounds a little more mental healthy than it does actual criminal, we have a co-response team of a sheriff's deputy and a behavioral health specialist that go to the scene. And they can assess whether is this something that is more sheriff's or is this something that is more mental health. And we've had pretty good success in de-escalating those and keeping people out of the justice system because it was a mental health issue. And now there is a place to send those people before there was not. So we are working on that. Again, it's a collaborative effort, and things are working well.
Yeah, and if I can emphasize that, I've talked to police departments who've told me that at least 40% of their calls are mental health, substance use, or partner violence. And that, and I know from working with jails around the country, especially pretrial jail detention, a lot of folks are there simply because the police didn't have a better idea. So having some place where those issues can be addressed that isn't the jail is huge.
I think it's important to know that in 2020, when there was a national push for law enforcement to professionalize and to de-escalate and to have mental health training, also to have mental health experts ride with law enforcement. I mean, that was a foreign concept. I hope you just picked up that we have worked hard as a county. I have 3 staff members, thanks to our Board of Commissioners, that has funded our positions, 2 sergeants and a deputy. Commissioner James Avery, who is an educator by trade and is a social justice heart. It's a collaboration, so funding for these officers who want to do it, because it is not easy to go and choose a different path than jail. So for the people of Genesee County, it's working. We answered the call, and there's more to do, but I think it's worthy to note. Dr. Johnson, how does this connect to a broader suicide prevention effort nationwide?
Yeah, like I said, I talked about National Center for Health and Justice Integration for Suicide Prevention, or NCHATS. I think part of what my colleagues and I are trying to do is really elevate this need, because I don't think the suicide prevention community really has thought much about it before this, and we're trying to throw up a big flare and say, hey, you know, this is really important. NCHATS is working with police departments in Massachusetts and managed care organization in Ohio and different folks to try to connect better the health systems, let them know when one of their folks may be in trouble, because, you know, the jails are not really able to do a lot of outreach, and you guys are just sort of always dealing with crises. And so I guess one question I have for you, if I can turn it back, is how do you think that we get other sheriffs, other police agencies involved? How should we be approaching other law enforcement folks?
Well, we have got a pretty good track record. We started GHOST in 2018, and we've now been in 64 sheriffs throughout the state. Of course, Ignite, which we started 5.5 years ago. These are vital services, but it's a huge lift to get people to understand the need, number one, but also that they can be part of the process to heal. So I think what we're doing right now is key. Number 2 is to have message bearers that are beyond law enforcement. So county commissioners, when they go to other counties, and other researchers that have relationships with their mental health world. I mean, I don't know of a person who could, in good conscience, turn down something, because we didn't pay anything for this. This was all funded by her research and going out and fundraising. So we need to scale this up. And that's why we're doing this. And that's why, you know, we put it on our social media, you know, with 210,000 followers, and we partner with the folks. I think it's important to know that not everybody is incarcerated. So the question I have is, what if somebody's watching right now and they want to know what that written plan is? And we said we're going to give it to the media, but what would be your advice? And I'll ask this question to all 4 panelists here. What's your quick advice if somebody's in crisis right now, but they're not incarcerated and they need help? Ms. Watts.
Well, the first thing is to call or text the Suicide Crisis Hotline. And thank God that they're all over the place, and typically all over the place. And the second thing is that reach out. Don't be afraid to speak up and share how you're feeling. Chances are someone has felt that same way and can get you the help. And chances are just having that conversation is going to expand the awareness. There are other organizations in the community that can also assist. So in that moment, like I said, GHS has behavioral health urgent care. It's the equivalent of an emergency room. They have the crisis hotline. And so there are lots of different resources to access. But the Suicide Crisis Hotline, you can text or call. And I know a lot of people are doing textings these days because they don't want to have that conversation. 988. 98, because I've not had to, thank God, have not.
All right, I'll leave the best for last. You know, I would say, I think her example is a perfect example of it is hard. I mean, there's times in life that just absolutely take the wind out of your sails. You know, when it feels like your world is crashing down and there's nothing left. And I think Karena's example is perfect, is if you can just stay alive and work the problem, it will eventually get better. It may take a while, but you can't solve it if you're not still alive. So I would say if there's anyone out there thinking about it, you matter. There's a lot of good you can do in the world still. The world needs you. So call 988. Do what you need to do to get through the moment because we need you here.
Best thing I can say that I did for myself is if like the suicide prevention hotline and things, I mean, sometimes it get a little redundant when you're the person in that situation. So for me, 911 and I'm in a crisis and I got to the hospital to be evaluated. So that's what I did for myself, because sometimes that 988 and let's talk, that doesn't always work the situation out. You might hang up the phone and still complete your mission. That's just my point about that. But when I felt like I couldn't pull myself together or keep me together, I didn't want that conversation. Excuse me, I'm in a crisis, I need to be picked up, I need help. And I was politely picked up and escorted to where I can be evaluated, but that's just my personal opinion about it. But please do, if you can, call the suicide prevention lines, 988, if that works for you. But for such as myself, after so long, that didn't work for me. And I had to take it a more effective step for myself. But please do reach out to anything that you feel is a help for you to keep yourself here, because you are worth it.
Dan, what do you recommend if somebody's in crisis right now and they need help?
I would just kind of reiterate what everybody has said, is that talk to somebody. Doesn't have to be a professional first step. Find somebody to talk to and know that there are resources. The most heartbreaking thing that we still hear is somebody who needed help and they say, well, I didn't know where to go, or I didn't think there was anybody to help me. There are resources. Just ask somebody. Again, it doesn't have to be a counselor or a psychologist. Ask a friend, ask a parent, a teacher, clergy. Say, I need help. Have them help you, and they will get those resources.
I think it's important to note that, as you've heard, a huge result in a study, but the overwhelming theme is sometimes these crises just pop up and they're over quickly. But it's in that moment that if somebody reaches out to you, you've got to seize it. It may not be convenient. It may not be something you're aware of or you don't know what to do, but just being present when someone is giving you what we call small cries, you got to pick up on those. You have to realize that, you know, it could be something that came out of the blue and you didn't see it. And I think those red flags that people throw up, they're asking you to throw a life preserver just for that moment. And it could be somebody at a gas station. It could be somebody at a business. It could be a business partner, a family member. I mean, there's so many things that go on in life that I think it's important that everybody here needs to realize that the stigma is no longer. Whether it's you or me, everybody has a turn in the barrel where we just feel like we are in a world by ourselves. And that you have somebody that you know and you love. We encourage you to fill out that one pager, have that with you. A preventative plan is what we need for when crisis strikes. And I will tell you, as we take one final comment, and then I'll close this up, is these may be our professional jobs, but we all bleed, we all cry, we all have pain. And so I'm gonna ask each panelist right here, what's the one reason why you do what you do in your profession or in your story? Why do you have the courage to come here? Then, if we have, a few minutes, open up some questions to the media and to our guests, and then I'll close it out, and then we'll go on our way. And I am confident that the study will encourage people. Somebody wants to say, I'm ready to do this. And more importantly, somebody may say, I need the help and I'm going to reach out. So I believe this is going to save lives. So to start, because Doc, I'm going to have you finish it, all right? I'm going to have our courageous observer and somebody who's been involved in the system. What is your why, Karena, is why you're here today?
Just hopefully, if I just reach just one person that's just feeling like they're alone or it's a joke or they're not being taken serious, just know someone will listen. Someone will believe it. You're not alone. Someone will believe.
But you got to reach out sometimes.
But you got to reach out. You can't sit there and say, help, and you're not sending, hey, you got to send that flare up. Hey, come here, I'm over here, you see me? And
Thank you.
Somebody will reach out.
Thank you for your courage. Ms. Watts, your why?
My why is to inspire people to discover their own inner wisdom, because everyone has it within them to help themselves as well as give and serve to others. So I'm in a serving capacity. I have a serving heart to inspire them, to ignite them in order to use the skills that they have deep within that they didn't even know they had. People such as myself are in a position to show them and help them bring out what they have, their gifts, talents, and skills, and every single human being has that. And lastly, it's also to empower them, to let them know that they have the strength, the courage, and the determination. Even in the most challenging and vulnerable situations, they have that. And so even if we've got to continue to follow up, that is my why, because I believe that every single person has that piece inside of them. And my mission, my heart's mission, is to draw that out in them.
Dan Russell.
I think we're all worthy of help, and we all deserve to be able to feel good. Mental illness is the one thing that is truly has no class, race, gender, sexual preference, hair color. It hits everybody, and we all deserve to be happy.
How many years have you been doing this?
I had my first paid job in mental health in Miami County, Ohio in 1975.
Dr. Johnson, why do you do this?
When I first went out, and this was a prison, this was different, but I was about 30, I had a couple of kids, went out to talk with women in prison for the first time, and that's who I saw looking back at me, women in their 20s and 30s with children. And as you talk with folks, you realize pretty quickly that one twist of fate and that could be your life. I talked to somebody whose boyfriend was too drunk to drive, so she drove, but turns out she was also a little bit intoxicated, and when she woke up, he was dead, and she was doing 8 years. And I talked to somebody else who was a kindergarten teacher who was in an accident and had surgery, was prescribed opiates, and that just was the beginning of a long downhill. And so you realize that life has its twists and turns that you don't see coming. And I guess I just want to try to smooth them out for people that I want to try to smooth them out for people.
A friend of mine, Jim Wiegand, wrote a book called Why is Greater Than Your What. It's one of my top 5 books, and he describes find something that thrills you, that kills you, and fulfills you. And when you cross all of those circles together, what's dead set in the middle is your why. And so I love doing what I'm doing, and I've been in this business since I was 18 years old, and we have been able to see people's lives transform. So all these things, say yes to a study or yes to officers and doing yes for Ignite, like that is my driving why, because I believe that if we give people a pathway to go from brokenness to healing, from darkness to light, we're changing generations. And that's why. People count on us. So I just want to say thanks to the panelists, thanks for the research, thanks for the tenacity, for the partnership, the collaboration. But ultimately, it's you as message bearers to carry this message. And we want to open it up to the audience and to the media for just a few minutes, and then we'll be on our way. I'm live. What inspired you to do this research?
Well, I got into starting working with people involved in jails and prisons. Like I told you the story. I walked in and I saw myself just in a different set of circumstances. I really think it's compelling. I think people don't realize there's, I think, more than 200 million 911 calls a year, 53 million police contacts, 8 million bookings into jail. Lots of people on probation. This system is vast and wide and complicated. It touches people at risk. And so, that's why I went into it, to help the moms, but then you realize the whole system needs help, so now the men too. And this particular study, so I've done that work for 20 years, mental health and substance use, trying to help people who are touching, like police contacts or whatnot, get the help they need in the community. That's why I was doing that. But this particular research, when my friend who was a suicide preventioner reached out to me and she said, we can't find some of the people who are at risk, but we think they might be in the justice system, the light bulb just went on, and I said, I've seen this. I know where they are, and we can reach them. Yeah.
Thank you. Yes, ma'am. The question is, what do you do if nobody hears your voice when you're crying out for help because of age or a class or you're incarcerated?
So I'll say I'll give you the other side, and then I think you're the one to answer this question, is that if someone reaches out to you, take them seriously. No matter who you are, take them seriously. And don't be afraid to ask, if they're sounding pretty bad, don't be afraid to say, are you thinking at all about suicide? Don't argue with them, listen to them, and then connect them to help. That's what to do. Don't be afraid. You might be the only person they reach out to. And I'll say that, the last person, this was just in my personal life, I told a parent that their daughter had talked to me about suicide, and I thought that they needed help. The next time I saw that kid was at her funeral. So take it seriously. And so I don't know if there were times you ever felt like nobody was hearing you, or what you would say to people when you feel like when they feel like they're not being heard.
Yeah, by me being African American, my gender doesn't matter. I'm African American. That's a taboo subject still to this day, even though with all the resources that are available. That is something that you really, you're not going to sit there at Thanksgiving and say, hey, I need help. It's kind of like you sweep it under the rug. It's something that everyone knows, but it's something that's not talked about. So I feel like if you feel like you're not being heard, scream, shout, whatever, someone's going to hear you. So there's a number of resources. You have co-workers. There's people around. You can walk up to a perfect stranger and say, hey, look, I'm feeling this kind of way. Maybe they will take it to heed, maybe they won't, but more so, someone's out there will help. Don't just react. If you have that split second to say help, please ask for help.
I think it's also important to know, we use this in our sheriff's office all the time, that to prepare in peace, to perform in chaos, which means have those talks when it's peaceful. We do this with human trafficking is, hey, if anybody says this to you, it's wrong. If anybody touches you, it's wrong. Hey, if this person comes to you and wants something and you feel like you have no place to go, you can come to me. Hey, listen, I want you to know that I don't have a password on my phone because I want you to come and talk to me and ask me what's on my phone. So I need to make sure that you don't have one. So we have this conversation. When you do all those things, whether they're young, it gives them permission that when the demon strikes, they already know, hey, I know I can go to. Nieces, nephews, friends, teachers, all those relationships are key, because you've seen this in ghosts. They may not come to me, but they may come to someone who doesn't look like me, but knows what to pick up on, and now we're getting to the right path. Everybody is worthy of the path. It's our job to give them permission to come forth and say, I need somebody to walk with me. In Michigan.
Yeah, so let me repeat the question, see if I got it. Is how to think about reaching out for help in a world where we're all stuck to our phones? I'll give a thought. I don't, and then if you guys have additional thoughts, but so I'm a suicide prevention researcher. If I try to Google an article, the first thing that comes up is suicide prevention resources. So even on your phone, help is there. So if you can call. If you need to call 911, do that. If there's anyone around you, say something. If not, text somebody. If not, like I said, I literally can't Google an article without, a huge thing coming across my screen that says, here's the resources. Go to the web page for American Foundation for Suicide Prevention. I don't have the cure for social isolation other than to just say, try to reach out and be mindful of each other. If you guys have wisdom to add to that.
Final thoughts or question? Well, I'll tell you, Dr. Johnson, thank you so much. Thank you, Karena. Thank you, Ms. Watts. Thank you, Dan Russell, the CEO of JHS. Thank you to all of our participants, the media. Let's reach out, look for each other, look out for each other, and let's lift each other up in love. So thank you so much to another chapter of success. We look forward to it. So thank you for joining us today.